Hello, lovely viewers. Thanks so much for sticking with us. Yes, it's another episode on Health Zone, and in today's episode, we are going to talk about diabetes. Yes, there are lots of things that you need to know about diabetes, and I'm going to introduce you to all the hula baloos. Please stay with us. We'll be right back after this break. Welcome back from that short break. Everything you need to know about diabetes. Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it does make. Hopefully, it can be treated, but untreated high blood sugar from diabetes can damage your nerves, eyes, your kidneys, and other organs of the body. There are a few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas where insulin is actually being made. Now, type 2 diabetes. This occurs when your body becomes resistant to insulin and sugar builds up in your blood. Pre-diabetes. This also occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. Now, moving to the third one is gestational diabetes. It's a high blood sugar during pregnancy. Insulin blocking hormones produced by the placenta cause this type of diabetes. A rare condition called diabetes insipidus is not related to diabetes mellitus. Although it has a similar name, it is a different condition in which your kidneys move too much fluid from your body. What you should know is that each type of diabetes has unique symptoms, causes, and different treatments that you can use to treat your particular diagnosis. Now let's go for the symptoms of diabetes. Diabetes symptoms are caused by rising blood sugar. The general symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue. You will always be tired, but the most common symptoms are sores that don't heal at all. You will see someone having a sore on the leg, on the arm, and it never goes away. Yes, these are some of the symptoms that you see a diabetic patient having. It may also cause recurring infections. This is because elevated glucose levels make it harder for the body to heal. Now, symptoms vary between men and women. Symptoms in men are, in addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, which is also ED, and poor muscle strength. Yes, they can't lift, a whole lot of things, and their strength actually fails them. Now let's look at the symptoms in women. Women can also have symptoms such as urinary tract infections, yeast infections, and dry and itchy skin all the time. They have these itchy skins and urinary problems. These conditions run in families. Family members share genes that make them more likely to get the type 2 diabetes and can also be overweight. Now let's look at certain factors that increase your risk for diabetes. Type 1 diabetes, you are more likely to get type 1 diabetes if you are a child or a teenager. You have a parent or a sibling with a condition, or you carry certain genes that are linked to this particular disease. That is when you are going to have type 1 diabetes. Now, type 2 diabetes, your risk for type 2 diabetes increases if you are overweight, if you are at the age of 45 or older, or you have a parent or sibling with the same condition, aren't physically active, you have also high blood pressure, high cholesterol can also include the type 2 symptoms. Diabetes can lead to series of medical complications, but you can manage the condition with medication and a good lifestyle. Avoid complications with these helpful tips. Healthy eating is a central part of managing diabetes. In such cases, changing your diet may be enough to control the disease. If lifestyle changes aren't enough to lower your blood sugar, you'll need to take medication and series of dieting sessions that will help in your condition. Insulin is the main treatment for diabetes. It replaces the hormone your body isn't able to produce. But there are 4 different types of insulin and other drugs that your physician can recommend for you. The drug or combination of drugs that your doctor prescribes will depend on the type of diabetes you have and its cause. Check out this list of various medications that are available to treat diabetes. So you can check them out with your physician, or you can go online and check all the diabetic measures in the market. Now, your family, environment, and pre-existing medical conditions can all affect your odds of developing diabetes. Find out which risk factors you can control and which ones you can't. Your health matters. In our next episode, we will look at diabetes in children. Yes, children also have diabetes. We will also bring on a health expert that will educate us more on this particular topic. Thank you so much for watching. I know you've learned a lot. Please don't forget to subscribe to the red button down there and like, share, comment. Tap on the notification bell so that we will notify you anytime we post a video. Thank you so much for watching. My name is Jennifer.